Welcome to Medical Ocean. Today we will discuss MCQs number 21. A client appears upset and tearful but denies pain and refuses the pain medications. Because my sibling is a drug addict and has ran out lives. What is the priority intervention for the clients? Option A. Encourage the expression of fear on past experience. Provide accurate information about the use of pain medications. Explain the addiction is unlike among acute care clients. Seeking family assistance in resolving these problems. G. Which one of the following is the best interventions when his sibling is already drug addict? G. Question number 21. Okay, encourage the expression of fear on past experience. Option A is the correct option. 22. The physician has ordered a placebo for a chronic pain clients. You are newly hired nurse and you feel very uncomfortable administering the medication. What is the first action for that you should take? Prepare the medications and hands it to the physicians. Check the hospital policy regarding using of the placebo. Follow a personal code of ethics and refuse to give it. Contact the charge nurse for advice. G. Question number 22. Contact the charge nurse for advice because you are doing work under the supervision of charge nurse. Which routine of administrating is preferable for administering of daily analgesic if all body system are functions? IV, IM, subcutaneous, oral, transdermal. G. If all body functions are stable in functionings, we will give oral painkillers, not IV. The nurse care plan is a written guideline for implementations and evaluations, a documentation of client cares, a projection of potential alterations in the client behaviors, a tool to set goals and project outcome. The question number 24 is a written guideline for implementation and evaluations. Option A is the correct options regarding NCP. Option A is the correct. 25. Critical care nurse is an area of specialized care collaborative interventions in the critical care nursing and therapies that requires physician and nurse interventions, nurse and client interventions, client and physician interventions, multi-healthcare professions. 25. Which one of the following is the correct options? Option D. Multi-healthcare professions. It's not between only nurse and physicians because collaborative means all healthcare. It's physicians, technicians, ward boys, LHVs, LPN, etc. 26. Which goal is the most appropriate for client with diarrhea related to ingestion of an antibiotics for an upper respiratory infections? The client will wear a medical alerts bracelet for antibiotic allergy. The client will return to his or her previous fecal elimination patterns. The client verbalizes the need to take an antidiarrheal medications PRN. The client will increase intake of insoluble fibers such as grain, rice, and cereals. G. Which one of the following is the correct option? Option B is the correct options. The client will return to his or her previous fecal eliminations patterns. Now MCQ number 27. A client with chronic pulmonary disease has a bluish tinge around the lips. The nurse charts which terms to most accurately describe the client's condition: hypoxia, hypoxemia, cyanosis, and dyspnea. Which one of the following is correct? Option C is the correct. Cyanosis is the correct. 27 में cyanosis is correct. Now 28. Cooper was five successive stages of death and dying are anger, bargainings, denial, depression, and acceptance. Denial, anger, depression, bargaining, acceptance. Option C, denial, anger, bargaining, depression, and acceptance. Bargaining, denial, anger, depression, acceptance. It means they are asking about the sequence. You should know about the sequence of Kubler-Ross. It's option. Which one is correct? Option C is the correct options. 9. A terminal ill patient usually experiences all of the following feelings during the anger stage except rage, envy, numbness, and resentment. Which one of the following is correct? Option C is the correct. Numbness. 30. Nurse and other healthcare providers often have difficulty in helping a terminal ill patients through the necessary stage leading to acceptance of death. Which of the following strategy is the most helpful to the nurse in achieving the goals? Taking psychological course related to gerontology, reading books and other literature on the subject of teratology, reflecting on the significance of death. None of the above. G. Which one of the following is correct? Option C is the correct. Reflect on the significance of the death. After having an IV lines in the place for 72 hours, a patient complains of tenderness, burning, and swellings. Assessment of IV site reveals that it is warm and erythematous. The usual indication is infection, phlebotomus, infiltrations, and bleeding. Which one of the following is correct? Option A, B, C, or D. Which one of the following is correct? Read and answer me. IV site is option B is correct. Which position properly the tip of a central venous catheter CVP should lies in the superior vena cava, basilica vena cava, jugular veins, and subclavian veins? Which one of the following is correct? Options A is correct. A nurse at HMC is revising a client's care plans. During which step of the nursing process does such revisions take place? Assessment, planning, implementations, and evaluations. G. Option D. Evaluation. We can revise the plan. 34. A male client is admitted to the hospital with blunt chest trauma after a motor vehicle accident. The first nursing priority for the client would be assist the client airway, provide pain relief, encourage deep breathings and coughings, splint the chest walls with pillow. Which one of the following is correct? First of all, you should ABC, assess the client airway. A nurse is assessing a post-operative adult patients. Which of the following should the nurse document as subjective data? Vital sign, laboratory test result, patient description of pains, ECG waveform. G. Which one of the following is correct? Option C, patient description of pains, because post-operative is subjective data. We already discussed that pain is highly subjective data. Therefore, pain is subjective data. Vital sign and ECG and laboratory test is objective data. A female patient with a terminal ill is in denial. Indicate a denial include shock to believe, numbness, patents, pre-operative grief. 36. Option A is the correct, shock to believe. Option A is correct, shock to believe. In 37, the doctor ordered dextrose 5% in waters, 1000 ml to be infused over 8 hours. The IV tubing delivers 15 drops per milliliters. The nurse in the charge should run the IV infusion at a rate of 15 drops per minute, 21 drops per minute, 32 drops per minute, and 125 drops per minute. Which one of the following is correct? Calculate it and solve the answer. Option C is correct, 32 drops per minute. When do coronary artery primarily receive blood flow? कब रिसीव करता है primarily? During inspiration, during diastolic, during inspiration, and during systolic. Option B is correct, during systolic. Which of the following is the most common symptom of myocardial infarction? Chest pain, dyspnea, edema, and palpitations. Option A is correct, chest pain. 40. Which of the following class of medication maximize cardiac performance in clients with heart failures by increasing ventilatory contractions? Beta-adrenergic, calcium channel blockers, and diuretics, inotropics. Which one of the following is correct? Option D is the correct, diuretics, inotropic. Which one? Option D, inotropics, is the correct. Thank you so much for watching this video. In the next video, we will upload soon. Be in touch, share, and follow.